So we've been sent a nice case. We want to evaluate, it looks like site number 20 for implant placement. And we can see here in this particular case, as is the case in many missing teeth, is we've had some tipping of this molar. So some of the bigger questions that we have to look at is, will this molar affect it? What are our choices? Do we need to do molar uprighting? And those are always difficult questions to answer. So let's go ahead and take a look at our plan. And what we'll do is we'll evaluate the plan based on the teeth as they are. And obviously we can do with the molar as we please. And obviously it's easy to say that uprighting is the most ideal way to do this, but we have to also take a look at realities of what may or may not work. So let's go ahead and take a look at it. So let's take a look at the plan based on our planning outline, and let's take a look at the mesial-distal position. Now, mesial-distal position shows that we're away from the roots, relatively well centered in the bone. If we take a look at our buccolingual position, we can see that we're relatively well centered in the bone. There are a couple of concerns I have about this. One is we're starting to engage the cortical plate along the entire wall of the implant. I would be okay if part of the implant engages the cortical plate, but I'm not a real big fan of the entire implant being this close to the cortical plate. So for me, I would like to see maybe something like that, just so that we don't have, when we have bone dieback, I don't want to take a risk of having perforation along that wall. So I would look more at something like this. Now I know why we moved it here, and that's to avoid doing the bone graft. But sometimes we have to make a decision that maybe this implant placement would benefit from a bone graft and not to place it just where the bone is or limit ourselves. So I would probably look at planning this implant, say, somewhere around right here in terms of buccolingually. So the next thing we would look at is bone level. And again, we can see here is the reason this was placed subcrestal like this, because we can clearly see that the bone level is right here. The reason this was placed subcrestal, again, would be to avoid doing the bone graft on these threads. So one option is to bury the implant. But burying the implant sometimes works and sometimes can create bigger difficulties for us. And I would say in a situation like this, that I would tend to believe that burying the implant would create a bigger issue for us. So one, if that were the level of the implant, here's what our restoration would look like so. And with the implant this deep, now we have all of this area right here and all of this area right here for there to be a food trap, given the limitation of this molar right here. So I would have a tendency not to bury this implant right here. I would want to go ahead and bring the implant up. Again, this is going to expose threads, but we want to do the right thing. So now when I bring the implant up, I have a better ability to adjust the contours. The next thing that we're going to look at is our occlusal table, and here we can see our implant is slightly more distal, closer to the distal tooth than it is to the mesial tooth. And I'm going to go ahead and jump up to our occlusal plane. And in looking at our occlusal plane, what we can see is that our teeth are tilted like this, and that's off-axis loading. So in an ideal world, what I would want to see is I would want to see these teeth flat, and that would look something along the lines of that. Now, if we take a look at this, this looks like more a natural occlusal scheme, what we would want the implant loaded onto as we're biting. But in having tilted that, that brings us way closer to the distal. So now what we may have to do is move the implant over slightly. Now we're more centered, and maybe we'll have to cheat and off-axis load just a little bit, but that would look more like my ideal placement, something along these lines. Now I have a good level plane. I have a good occlusal table. I'm mesiodistally more placed. I'm more ideal here, far enough away from adjacent root number 21. This would also bring me into the use of this particular implant. One, we see that this root curves a little bit. We're getting a little closer here, not overly close, but a little closer. So the Straumann implant is a relatively straight implant. So if we were to use a traditional tapered implant, like say the active implant here, we could see that we'd actually have more room here at the apex of the implant. But let's go back to the bone level Straumann implant. And we can see that, so again, this case can be done. For me personally, this is a relatively straightforward case. Place the implant, graft a little bit at the time of placement, place a membrane, cover the implant up, wait 4 months and 4 or 5 months, and then come back and restore. But there are issues to deal with. And I would also, with that thin of a implant, I would probably go with a longer implant, like a 12 millimeter implant. So this gives you an idea of what we're looking at. The last thing we'll have to look at is our sleeve. And all these things play a role because some of us are needing guided surgery tremendously to be able to do these cases. So we'll look at the sleeve location here, and here we can see that to have this sleeve, we can barely get this sleeve to fit. So this sleeve will fit. It will require some adjustment on the mesial of tooth number 19. So, honestly, if I were going to adjust the mesial of 19, I would go ahead and move the implant over just a hair like this and adjust the mesial of 19 a little bit more. But I would be prepared to graft this site. Personally, I would use a different implant, an implant that will expand and give me more stability, allow me to do a little bit smaller osteotomy diameter, expand the bone. But again, the Strawman implant is a very good implant and it certainly will work in this situation. Just need to be prepared to graft about 5 or 6 threads in this particular case. Hopefully this was very helpful to you, and we look forward to additional cases.